It's a pleasure to be here, and I look forward to talking about how natural language processing can be used to improve the transformation of healthcare. I want to start from the patient perspective about the current state of affairs, and this is Laurie Becklund. She's a journalist who died of breast cancer, and the day or two before she died, she published an editorial bemoaning the fact that her doctor was not able to use any information from other patients to know what worked and what didn't for them and what might help her. And in spite of all the funding that's been donated towards breast cancer research, that still in this year, this day and age, she was like a one-person clinical trial, and that is a travesty. From the clinician perspective, patients only receive about 55% of recommended care for different types of conditions, chronic conditions. And you can see here that breast cancer and colorectal cancer are higher than many of the others. But why is that? Why? This is for care that we know, we have guidelines on, and we know best practices. It's not that they don't want to provide that care, it's really information overload. The clinician has a short amount of time. They have to, find all the different guidelines that are relevant for the patient, keeping up to date on all the literature, information on the web. Patients are now generating their own data that they would like to help with interpretation of from their clinicians. As we get more and more knowledge about the genomic contribution to disease and population status of germs that are going around the community, this is way too much information for one person to integrate and do a physical exam and everything that they need to do within one visit. So it seems that we're drowning in data, but we're lacking in knowledge and the ability to quickly act on that knowledge. Well, natural language processing is a way to extract information out of text. And why is that important in healthcare? Because about 70% of the information that is needed to take care of a patient is contained in text rather than in structured fields. And as such, it's not available for decision support systems or other types of computerized systems. It's only available for browsing, and searching text is not easy. And so I want to talk about how natural language processing has been being used in 4 areas to improve our ability to provide care to patients. The first is in the usability of electronic health records. And so electronic health records are an important part of improving communication and care of patients. But as those who have already implemented them have seen, it has a downside too. It takes a lot of time to use an electronic medical record, and the amount of information has exploded. And so now most of the time that patients spent on an EHR while they're interacting with patients is searching for information. This is a typical screenshot of an electronic health record. It's at New York Presbyterian Hospital. It's organized by the patient encounter and by date. That makes it very difficult if you want to do something like find the information about a current condition that the patient has, and what's been done in the past for that, what their complaints have been in the past, what their treatments have been. So Noemi El-Haddad decided to build a natural language processing system that would help present salient problems to the clinician across multiple care settings so that the clinician could really work from that problem-oriented medical record. So this is the interface of the Harvest system. And in the middle, you have the problems that occurred most often in, in the record of that patient. And larger words indicate that it is mentioned more frequently. So the clinician has clicked on the term dyspnea, and above that is a timeline of all the mentions of dyspnea in that patient's record over time. If you click on one of those bars, then all the notes and fields that contain the mention of dyspnea are displayed. And if you click on one of the notes, now it shows you the cardiology consult free text note, and you're able to find where that mention was. So with this interface, clinicians were able to find information that they normally would have had to hunt for and maybe not had difficulty finding. and felt much more confident that they weren't missing information because they got this overview based on the salient clinical problems. The secondary area where natural language processing has been applied is predictive analytics. Determining the risk of a patient to be readmitted to the hospital is one of the hot topics of the day because there's a lot of wasted resources and also patient suffering if they have to come back to the hospital unnecessarily. And when you build a readmission model, typically if you use the structured data like billing codes, prescriptions, and procedure codes, the performance is mediocre. There's more information in the electronic health record that could be helpful for predicting readmission. And a lot of that is stored in text. So information about, their mental state, their social risk factors, like whether or not they have social support at home, whether they have stable housing, if they're compliant with their medications, whether they can bathe themselves. All of that information is stored in text and could be very helpful and has been shown to be useful in increasing our ability to predict when a patient is readmitted. Social media is another data source that is text, where that gives us a lot of insight into what people are thinking and doing. And this study demonstrates how natural language processing of social media posts can help predict suicide attempts. And they were able to predict suicide attempts with very high sensitivity in the 90s and positive predictive value in the 70s. And they found that the variables that helped them predict suicide had to do with the emojis that the users were using. They were narrowing their group of emojis, using fewer of them, and also there were more tweets with sad or angry words in them. The third area is phenotyping. The phenotype is the observable characteristic of an organism, and in our case of a patient. And right now, the information that is available digitally for phenotyping from electronic medical records tends to be, claims data and procedures and medications. But that's just scratching the surface. Underneath there is all kinds of information in the EHR about that would enhance our ability to phenotype the patient. One use of phenotyping is in research. You need to create cohorts of patients to be able to do retrospective studies. And this is Salome Kihani at UC San Francisco and the San Francisco Veterans Affairs Hospital. And she wanted to compare whether medication or surgery worked better for patients who had severe carotid stenosis. And so to do that, she needed to look through patient records and determine whether they had severe carotid stenosis. And if they did, then she would look at the structured data, which was, the treatment and measure and compare the outcomes. So natural language processing was key to helping create those cohorts. But, we do a lot of simple phenotyping with things like, does the patient have, breast cancer or no breast cancer? But there's a lot of information in the electronic health record, and particularly in notes, that could help us identify richer phenotypes to be able to do much more sophisticated studies. For instance, in pathology notes, that rather than just saying, we're going to look at patients who have breast cancer or not, we know a lot about that patient. We know about the sidedness of the breast cancer. We know about what therapy they've had, whether they're a candidate for certain therapies, their family history, whether they have certain genetic mutations. And if we can extract that with natural language processing, then we can start to ask much more sophisticated questions about the types of treatments that are working, treatment effectiveness, as well as recurrence and metastasis. The fourth area is improving the quality of patient care. There are a lot of different quality measures that people are looking at to try to track how well we're doing, and by tracking, we're able to improve our care. And one of those is how well colonoscopies are quality measures for colonoscopy exams. And one particularly important measure is the adenoma detection rate, which is of all the screening colonoscopies, how many of them had an adenoma for a particular clinician. So Andrew Garon is a colonoscopist, a gastroenterologist, and at most places in the US, they hire people to do chart review on a yearly basis and calculate the adenoma detection rate for a sample of physicians and a sample of patient records. And that gives them some idea about how well they're doing in that area. And he wondered, well, couldn't we apply natural language processing to extract that information so that we could have a broader sample and have more real-time feedback? And it's important feedback because if you can increase the adenoma detection rate by 1% for a particular physician, then you can decrease the mortality from cancer in that physician's patients by 3%. And showing information to the patient, to the clinicians, has been demonstrated to be effective in changing their behavior. If you can compare them to their peers, and they can see that their adenoma detection rate is much lower than would be expected and much lower than their peers, then they'll be more active in trying to increase that. Well, so I just described how natural language processing can do some amazing things that are very important to our transformation of healthcare. Then the important question is, well, why don't I have it at my institution? Why isn't everyone applying natural language processing? So what I described was this Ferrari 458 Italia, which is beautiful and everyone wants to have one, but not everyone does have one. And if you look at the details, you'll know, one reason is price, and price comes into it with natural language processing too. There's a lot of resources to be able to do these things, but let's look inside the motor and see what makes it difficult. I'm going to talk about 4 challenges for natural language processing. The first one is that the data that you're working from is natural language and it's very messy. And there are a lot of variations in text for describing what's going on with the patient. And as clinicians start using electronic medical records and typing information, they have a lot of freedom to create templates, which help them be more efficient in their documentation. And that's important, but it really hampers the ability to do natural language processing because these templates can look like anything. And the natural language processing system is looking for sentences and periods or headings and can't manage this type of variation. So that makes it a challenge. One study at the VA in the US showed that there are 58 classes of these types of templates, including tables and checklists. The secondary is the meaning. The text is just ASCII characters, but what does it mean underneath it? When you're building a natural language processing system, you have to represent the meaning somehow. And so when we're talking about phenotyping and we say, well, I want to find patients with a cough. And when you start working with clinicians, this is typically, they'll give you a really broad phenotype definition. Well, what do you mean by cough? Because there's a lot of different ways things that you might care about for cough. And say, well, I would define cough for my project as at least 2 episodes of severe cough in 1 year. Well, to be able to identify that, you have to do layers of processing of the text. And first, you have to look at individual phrases that describe things like history of cough. The cough has worsened. So you have to identify those in sentences. And then within a report, there are many sentences and there might be many mentions of cough. And they describe something that happens over time. And so the mentions might change and contradict each other seemingly. So you have to be able to integrate that information into a document. In this report, what is it saying about cough for this patient? And then within an episode, there are multiple reports. And so you have to be able to represent knowledge at these different layers in order to answer the single question, did the patient have at least 2 episodes of severe cough in 1 year? When you're looking at that data, you might think, well, we'll just search for the word cough. But you care about more things than just that the word cough was mentioned. You might need to know whether, how long it lasted, or what if it changed over time? Does that influence your phenotype? What about whether it responded or not to treatment? Do you care about severity? And so defining what you mean and representing that knowledge is a big part of building a natural language processing system. The third area is related in that sublanguage. A sublanguage is a subset of a natural language, and because it's a subset, it has particular vocabulary and grammatical rules that are used, and you can count on those regularities to improve your performance of a natural language processing system. But at the same time, you have to really be able to understand and model that sublanguage to make sense of it. A good example of sublanguage is social media. With the emojis, abbreviations, hashtags, your natural language processing system is going to interpret, tweets or information on Reddit. It has to really understand this sublanguage. If you had a natural language processing system that you trained or built using newspaper data and you wanted to apply it to social media, it just wouldn't perform well. There are even different types of sublanguages within medicine. Medical blogs are very different from clinical notes in their use of verbs, the types of clinical descriptions that they have, and even just what they talk about. So understanding that and modeling that in your NLP system is critical to being able to build something that can really extract meaning. And the fourth area is just the variance. There's so much variation in what we can say and how we can say it. And a lot of words have the same meaning. And so in English, we have very little morphology, but even that amount of morphology can cause trouble for an NLP system because you have to be able to know that the adjectival form of the noun mediastinum still has the same meaning. They're not two different words. Or, the past tense of a verb is the same as the present tense in terms of the concept cough. But the biggest source of variation is synonymy. There are so many different ways that we can say the same thing. And your dictionary or your machine learning system has to have seen a lot of examples to be able to catalog them all and recognize them. This is a really old study, but I wanted to still show it because even in 2002, there are a huge number of new abbreviations being introduced into PubMed. An average of one new abbreviation in every 5 to 10 abstracts. And this study hasn't been repeated, but I'm guessing it's just exploded since then. All right, so I showed you the beautiful Ferrari and you got all excited, and then we looked under the hood and now you're discouraged. How can I really build something that can address all of that? And so I want to talk about from the perspective of a clinician, how can you approach a natural language processing project? And so I want to look at the idea of like low-hanging fruit and high-hanging fruit. And first of all, you need to know, is this something that's fairly simple to solve or is it really complex? So let's look at some heuristics for that of low-hanging fruit. If it's something that's explicitly mentioned, and so for chest pain, for example, that when you're talking about chest pain in a report, you're using words like chest pain. And so it's like very explicit. Do you understand the classes and relations that are involved? And if they're diseases, problems, anatomic locations, there are a lot of materials and resources out there that you can use to create dictionaries very quickly and find synonyms for these types of classes. And so if you know what you're looking for, it's more of lower hanging fruit. And then the third heuristic is the vocabulary. Is it unambiguous? When you see the word pneumonia, does it have multiple meanings, or does it just mean it always means pneumonia? An example, I'm going to give that example on the high-hanging fruit. So let me give some examples of low-hanging fruit projects that I've done with collaborators. And the first is in quality. Radiology department runs a monthly report of the pulmonary embolisms and VTEs and radiology reports for their quality measurements. And they're doing this by hand and, looking through reports, very time consuming. They said, well, let's try it with ICD codes, but, not very accurate. And so we built a quick NLP system that looked for mentions of pulmonary embolism and VTE in the reports and looked at negation. It also looked at, is it acute or chronic? What side is it on? Is it segmental, et cetera? And so now they're able to run this automatically, and it gives them much more information than they could have had from ICD codes. And so this is running at the University of Utah Health. I talked about the colonoscopy quality study, and Andrew Garon is now piloting the deployment of a report card across the US in the VA, and so that you as a clinician can look at your quality indicators and compare them to other clinicians and look at your performance over time. The second area is in research. And so I talked about the severe carotid stenosis study. So we built an NLP system to identify reports that indicated the patient had severe carotid stenosis. And we're able to exclude a lot of reports that we were confident did not mention severe carotid stenosis. And that decreased the need for chart review by 70%. That's important for research because one of the big barriers is the manual chart review to create these cohorts. And so the NLP system doesn't have to be perfect. It just has to be good enough that you can exclude some that you're either confident they're negative or confident they're positive, and then identify those that need human review. And the third area is in decision support. This is a study that's ongoing at the University of Utah to flag patients with a family history of breast or colorectal cancer. And there's actually multiple types of cancer that they're looking at even beyond these two. And identifying patients who are in need of early screening because of their family history. So we use natural language processing to identify the relative, the type of cancer, and the age of onset from a field in the EHR. And then that information is now flagged in the patient portal in Epic in MyChart, and an email is sent to the patient indicating that there's a need for early screening and we recommend it, and click here to schedule an appointment with the genetic counselor. And so the natural language processing, the hard part is not identifying the cancer, that's quite explicit, it's the age. Because when it gets to time is very difficult to identify in text. But this simple system called PyContext, and there's another version of it in Spacey right now, was able to identify the onset, age, or ranges of dates quite accurately. And using that, then they were able to find 50% more patients who needed early screening than just using the structured data in the reports. So those are some examples of real projects that are deployed at health systems where NLP is a part of them. So let's look at the high-hanging fruit so that you can differentiate between things that are doable and things that would take a lot more effort. If what you're looking for requires a lot of inference, then it becomes much more complicated. And so we talked about explicit mentions like do they have pneumonia, and it says the word pneumonia, or chest pain. But if social support is one of those examples where it never says the patient has social support. It's not explicitly mentioned, or they don't have social support. Instead, it talks about the patient and their family members, and brother at bedside is an indication that the patient has social support. Her son mows her lawn would be an indication that the patient has social support. But to be able to build an NLP system to identify that, you're not only looking for particular explicit words like social support, you have to be able to model many more semantic types like family members and chores and transportation, and then make inference from that. So it's much more complicated. Looking at the vocabulary of, is it ambiguous or unambiguous? A better example than this for ambiguous vocabulary is the word fall. And I know that's not used in Australia to indicate autumn, but in the US, it's used very frequently. And so if you're trying to find patient falls, there are many words fall in a patient record that do not indicate that the patient fell. And so now you have to build a disambiguator up front to try to filter those out before you can even get to the task you're looking for. A third area that makes something more complicated is when the syntax and the semantic roles are important. And so often you can just use the presence of words in a sentence to know whether or not the patient has the disease. But if in this case, the wife helps patient with meds, or the patient helps wife with meds, have very different meanings. And if you have to be able to differentiate that, you need a lot more processing than just looking for words in a sentence. And then the fourth area that makes things complex is the temporal reasoning. Identifying expressions of time and then integrating that information across a temporal story is complicated. And, there are NLP systems to do that. And all of these things, you can do these things, but it just makes them more difficult. An example of how you might need temporal reasoning, Karen Verspoor, who is at the University of Melbourne and does natural language processing, they were trying to identify temporal variations in symptoms. And so looking for pain-related descriptors and their temporal modifiers. And that becomes much more sophisticated NLP system that you're building. So in conclusion, there is a lot of information that's locked in text that can be very helpful for research, for improving quality, and for decision support. But to extract it out of the text, you need to apply natural language processing. Natural language processing can be successful, and it's being deployed across the world in targeted ways. But we need to have more people working on these problems. We need access to data. This is a huge issue in Australia. In order to really work towards these deployed NLP systems, we need to have data that we can, train and test on and build our systems for. And then NLP is generally a part of a larger decision support system or research program. And so, integrating it into apps and systems. And because of that, you need a really multidisciplinary team. And that's why clinicians are a really important part of this. This is a partnership with a clinician, a natural language processing person, someone that can do data analysis and programming. There's need for all different types of skills to build natural language processing and make it effective. And it's not terribly straightforward, but it can be done, and it's an adventure. And so I invite you to join us on this path and let us know if you want to work on some natural language processing tasks together. Thanks.